People promise you can heal your gut in 3 days with a detox juice. Here's the truth. It's a myth. The real question is, how long does it really take to heal your gut? If you struggle with bloating, fatigue, skin issues, or IBS, the answer is not 7 days. The real answer is 7 days, 7 weeks, or sometimes 7 months. In this video, you'll discover the true healing timeline, step by step. Before we talk about timelines, we must understand what we're actually healing. Healing the gut can mean 3 completely different things. First, your microbiome, like a garden sometimes overgrown or depleted. Second, your mucosal barrier, the protective wall separating you from the outside world. Third, inflammation, the fire your immune system ignites when it feels threatened. The microbiome is the fastest to change. Research shows that when you drastically switch your diet, removing sugar and ultra-processed foods, bacterial populations shift in only 72 hours. That's why after holidays or overeating, you can feel better in 7 to 14 days. You've probably heard that intestinal cells renew every 3 to 5 days. That's true, but it does not mean your gut heals in 5 days. Imagine a brick wall. Your cells are the bricks, but inflammation is like a constant earthquake shaking the cement between them. You can replace the bricks all you want. If the earthquake continues, the wall stays broken. The gut barrier only heals when inflammation stops, and that takes 3 to 6 months. You cannot heal an inflamed gut if your brain is in panic mode. Chronic stress increases cortisol, weakens the mucosal barrier, and feeds bad bacteria. It's like trying to extinguish a fire while pouring gasoline on it. After overeating or a few days of bad choices, only the microbiome is affected. Quick diet correction, quick recovery. Months of poor diet, antibiotics, or burnout can wipe out good bacteria. It takes 1 to 2 months to rebuild colonies and calm the surface inflammation. This is deeper damage. Inflammation is chronic and the barrier is compromised. It takes 3 to 6 months to restore tight junctions and rebuild the mucosal shield. For IBS, SIBO, reflux, Crohn's, or celiac disease, healing is a full-body protocol. Food, stress, sleep, nervous system, medical support. Some studies show 1 full year is needed to normalize permeability in celiac patients. If nothing changes after 2 months, one of these is blocking your healing. Stress. You can't heal if your brain stays in survival mode. Sleep. Repair happens at night. No sleep, no healing. Hidden irritants. Foods or medications irritating your gut without you knowing. Here's your timeline. Small disruption, 2 weeks. Weakened microbiome, 1 to 2 months. Leaky gut, 3 to 6 months. Chronic conditions, 6 to 12 months. Healing your gut is a marathon, not a sprint. And you? Where are you in your healing journey? Tell me in the comments what worked, or didn't, for you. And if this video helped you understand your gut better, subscribe for more science-based health content.